Hi, my name is Alex Johnson, and today I'll be doing my informative speech on levels of NICU and NICU care. I've chosen to do this speech because I currently work in a NICU. I work in a level 4 NICU as a PCT or nurse helper CNA, and I think it's really important that people understand why there are different levels of NICU, especially if you're looking to go into nursing school and interested in NICU, what that can mean for your career, and if you have family or friends who end up in a NICU, what kind of NICU they are in can give you some hints as to what kind of care their child needs and how you can support them as a friend or family member. The first there's 4 different levels. There's a first, second, third, and fourth. The first level is also known as a well baby nursery, and these babies are between 35 and 37 to full term weeks gestationally. They get routine care, feeding, bathing, vitals, and stabilization if needed. A level 2 NICU is also called a special care nursery, where the care starts at around 32 weeks gestational age and up. Here there's advanced respiratory support like CPAP, which is a positive pressure airway into the nose. And these babies are not typically critically ill. Sometimes they need some feeding support, sometimes they go home with a little feeding tube, and these babies also have IVs and can get medicine and fluids through an IV if needed. A level 3 has a big step in care. They are a level 3 and a typical neonatal intensive care unit. So this care starts at 32 weeks or weighing less than 1,500 grams. These are critically ill babies. They need sustained life support, which usually includes an endotracheal tube, which is a tube that goes down their throat and helps pop open their lungs and takes breaths for them. This also includes a care team of neonatologists, a special baby doctor, RNs, RTs, dietitians, and CNAs. A level 4 is also known as a regional neonate intensive care unit or surgical neonatal care unit. These babies are critically ill and they either need surgeries or they are medically complex children and may have a lifelong disability. This team also will perform surgical procedures at the bedside, or they are also capable of ECMO, which is an additional respiratory, heart and lung respiratory support for very, very sick babies. This care team includes of neonatologists, nurse practitioners, pediatric surgeons, cardiologists, nephrologists, RNs, RTs, CNAs, lactation specialists, dietitians, everyone. Everyone is involved in this care. And I chose to do this informative speech on NICUs and the levels of care that are in each one. For anyone who might be looking into nursing school and is interested in NICUs, they are not all created equal. They all take care of babies, but the level of intensity and the care that they need differ. Again, I think it's really important to understand those different levels, especially if you're ever to find yourself in a situation where you have a family or a family member or friend who is in a NICU, then you know how to support them and show up for them during their time of need. Thanks.